College, and Jeff Roberts, Administrator of Elections for Davidson County. Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Michael Caldwell, Director of Public Health, are here to help answer your questions. We'll now begin with Mayor John Cooper.
Good morning. Nashville faces another challenge in a season of challenges. Our Phase 3 has not been effective, and we're going to go back to what we know is effective in slowing the spread of the disease. Beginning Friday, July the 3rd, and for the next several weeks at least, Nashville will revert to a Phase 2 with modifications for the roadmap for reopening Nashville. The modified plan is tailored on what we've learned through contact tracing investigations over the past several weeks. It is in response to sharp recent case increases and clustering of cases. Now, 4 of our 6 health metrics for reopening Nashville are green. Our transmission rate is yellow, between 1.03 to 1.16, but our 14-day rolling daily case average is red. Today's new confirmed case count is 608, a record daily high for Davidson County. This means we have to respond as a community to get us back on track. Now, it is clear that adding any public health risk is inappropriate for Nashville at this time. So we've directed the Nashville Convention and Visitors Corporation to cancel its fireworks display on Saturday evening. Channel 5 will air a 1-hour special from 9 to 10 p.m. showcasing local artists and previous year's fireworks displays. New cases are rising in 36 states, unfortunately, including here in Tennessee. We stated at the outset of our phased economic reopening, a spike in cases would result in a public health decision to impose more restrictions on our reopening, and we are. In this modified next phase, many socially driven businesses and activities that opened in Phase 3 will be temporarily closed, including event venues and entertainment venues. To be clear, our limit on gathering size is 25. And restaurants will move back from 75% capacity to 50% capacity as permitted in Phase 1. It's worth noting that Nashville's rate of confirmed cases did decline while bars and restaurants operated at 50% capacity in May. Now, Metro Parks facilities opened in Phase 3 will remain open, including dog parks, skate parks, basketball courts, and playgrounds. And recreational leagues and pools will still be permitted, as outbreaks have not been traced back to these venues or activities. Now, of course, we urge you to practice safe social distancing around swimming pools this weekend. Additionally, all bars in Davidson County known as limited service restaurants that derive the majority of their revenue from alcohol sales will close for a minimum of 14 days, beginning tomorrow, which is equal to 1 incubation cycle of the coronavirus. Our public health investigators have found a record number of clusters originating from bars within the past week, which have affected employees, patrons, and musicians. Multiple bars in the downtown and midtown neighborhoods have recently closed because of outbreaks among their staff and patrons. Every decision related to our phased economic reopening has been made with unanimity among our public health experts, including these announced this morning. Nashville is not alone in making these difficult but necessary changes for the sake of public health. In fact, 19 states are pausing or changing their reopening plans due to an increased number of confirmed cases. Recently, Texas, Arizona, Florida, and parts of California and Idaho closed all its bars ahead of the Independence Day weekend to slow the spread of the virus. Los Angeles announced yesterday that it would immediately close all restaurants and bars, which were only recently allowed to reopen to 60% of capacity. Now, on Monday, the city of LA reported approximately 3,000 confirmed cases, or about 75 out of every 100,000 residents, more than all but 3 states nationwide. But in Nashville, today's confirmed case number of 608 represents 88 out of every 100,000 Nashvillians, a higher number than in Los Angeles, a higher comparative number than Los Angeles. In the state of Florida, where bars and nightclubs have been closed for a second time, the positivity rate of confirmed cases as a 7-day moving average is 16.1%. That is below Nashville's current rate of 16.5%. Our positivity rate is also 2 points higher than the statewide rate in Texas, which is 14.4%, which has also closed all of its bars and reverted to restaurants at 50% capacity. Make no mistake, we are still in a public health emergency. The decision to pause and reset is not an easy one, but the health of our residents and visitors has been and will continue to be our number one priority. We also have an economy that residents depend on for their livelihoods. As we announced over the past weekend, Metro Public Health now requires everyone in Davidson County to wear a mask in public places, with appropriate exceptions for certain individuals, including children and those with medical conditions. Memphis and now Knoxville also have mask requirements, and we are recommending that the state and certainly neighboring counties in our economic region implement similar policies. Masks are an important tool. Let's use them. Now, our public health experts have made it clear that the coronavirus will be with us until a vaccine is widely available. Until then, every Nashvilleian has a duty to practice healthy habits to keep our community safe. Remember, face coverings are not a substitute for safe social distancing, frequent hand washing, and receiving prompt medical attention if you feel symptoms of COVID-19. Since our first documented case of COVID-19 on March 8th, Metro and our local healthcare partners have conducted 98,452 diagnostic tests, representing over 14% of Nashville's total population. We continue to exceed the state's testing capacity at 11.9%. Whether or not you think you may have symptoms of COVID-19, do not hesitate to receive a free COVID-19 assessment and diagnostic test at any of Metro's 3 community assessment centers. Visit covid19.nashville.gov to learn more. Our contact tracing staff at Metro Public Health have conducted over 10,800 investigations and are working hard to learn how the virus is behaving so that we can better respond as a community. Our floor bed and ICU bed capacities are also both above our target goals of 20% and 21%, respectively. Now, as of yesterday, 3,172 Davidson County residents are under a quarantine order. And since our citywide COVID-19 response began, nearly 10,743 individuals have tested positive and received verbal and written quarantine orders from public health. Dr. Jahanger will present more details about our COVID-19 metrics momentarily. By observing our public health orders and maintaining a safe social distance from one another, wearing a face covering whenever possible, we can limit the spread of disease and help protect each other. Every one of us has an individual and societal responsibility to slow the spread of the coronavirus. It's up to all of us to stem the tide of this disease so that we can continue our economic recovery while saving lives. This morning, I want to welcome Dr. James Hildreth, President and CEO of Meharry Medical College, who's here to share his thoughts on COVID-19 and our community's ongoing response to the disease. Now, a June 4th ruling by the Davidson County Chancery Court allows anyone in Nashville who does not wish to vote in person due to the COVID-19 outbreak to request an absentee ballot by mail. Now, it's a pleasure to welcome Jeff Roberts, Administrator of Elections for Davidson County, who is here today to tell us more about the absentee ballot process. And this Saturday is Independence Day. And of course, this year's 4th of July is unlike any other in recent history. And we must all remember to remain united in our response to the coronavirus. And I urge everyone to celebrate the 4th of July at home this year, avoid large gatherings, as we reflect on the founding principles of our nation and renew our own commitment to these truths, that everyone is created equal, that all people, regardless of race, color, or ethnicity, are deserving of justice and liberty and the freedom to pursue a lifetime of happiness. And I wish everyone in Nashville a very happy and safe Independence Day, and I turn it over to Dr. Alex Jahanger, Chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning, Nashville. Here's the latest on coronavirus in Davidson County. We now have 10,743 confirmed cases. That is an increase of more than 2,100 cases since our last update last Thursday. There are currently 3,172 active cases in Nashville. That's up 979 from last week. 70% of all confirmed cases, or more than 7,400 residents, have now cleared of the virus. Since our update last week, 12 Nashvillians have died of COVID-19. 108 Nashvillians have now lost their lives as a result of COVID-19, with a mortality rate of our city at 1%. My sympathies do go out to all the families and friends of our lost Nashvillians. Now, our 14-day rolling average of new cases continues to increase. This morning, the average of number of cases is 209.5. That's an increase of 76 more cases per day since last week. Now, here's how other metrics look. 10.9% of all the people ever tested positive. That's up 0.7% from last week. The doubling rate of the virus today is 28 days. It was 37 last week. This morning, we have 21% of hospital beds and 24% of ICU beds available in our region. 148 people are currently hospitalized in Davidson County hospitals with COVID-19. The transmission rate for Nashville is around 1.1. Testing capacity remains at a satisfactory level for a city of our size. In fact, since last Wednesday, the city of Nashville has conducted nearly 13,000 tests. And our contact tracing resources continue to monitor the spread of the virus and give us information daily that informs our response. Now, while hospital capacity, testing capacity, and public health capacity are all satisfactory, our 14-day rolling average of new cases is absolutely not satisfactory. In fact, it's very troubling. Today's new cases, more than 600, is the highest single case count we've ever reported. Furthermore, this week has been the biggest case count we've reported in 1 week. Now, we did have an outbreak in the Davidson County Jail. However, these cases represent about 140 of the new cases for this past week. And while we are testing more people, that's not the reason we're seeing an increased number of people turning positive. Based on this record jump in cases, the mayor has decided to go back to, as he describes, a modified phase 2. This decision was not made lightly. However, the increase in new cases show that we are not where we need to be. And we need to act now to stop the attack of this virus. Please go to our website, www.covid19.nashville.gov, to get more information about this modified phase 2. Now, more than 61% of all of our confirmed cases are from Nashvillians under the age of 40. This group tends to be healthier, and the virus may not impact them as much as it impacts those who are medically fragile or older. This is part of the reason why our hospitalization and mortality rates are lower than other cities. And this is one of the reasons why the virus spreads within our community. Now, you may feel healthy, and you may think that getting the virus is no big deal for you. However, you can give the virus to others. You can give it to someone who has a medical condition. You can give it to an elderly family member, and they may die because you were careless. Now, you need to wear a mask. You don't gather shoulder to shoulder in big groups. Don't share drinks, and stay at home as much as possible. Please do your part to stop spreading the virus in our community. Now, a word about this weekend. We saw a spike in cases after the Memorial Day holiday. With 4th of July coming up, I ask you to remain vigilant. If you're traveling, wear a face mask, stay your distance, and wash your hands. When you come back, if you have the slightest concern that you may have the virus, get a test. Limit your gatherings this weekend to no more than 25 individuals, and don't go out to crowded places. And again, stay at home if possible. Our community assessment centers are open today, and they will be closed tomorrow because of the 4th of July holiday. However, they will reopen on Monday. Just last week, nearly 6,500 individuals were tested at one of our 3 community assessment centers. I want to thank the staff at Meharry Medical College, the Office of Emergency Management, the Metro Public Health Department, and all of the volunteers whose tireless efforts allowed this to happen. Now, finally, there is a lot the city can do to fight this virus. We have mandated masks in Nashville. We continue to ask you to stay apart and stay at home if possible. We can enforce restrictions to influence behavior. However, we cannot make you do your part. And we are at a crossroad again as we fight this virus. We can go back to what we were doing in the spring and practice personal responsibility. This will get the virus in check and again flatten the curve. Or we can continue down the path that we're currently on and keep doing what we're doing, not taking personal responsibility to keep our community safe. But I assure you, if we continue down this path, this will get worse and we will lose this battle. So this virus is not going away anytime. And I need all of you to please take this personal responsibility and step up and help us fight this battle. I'm very grateful for all you are doing in Nashville, and I now would like to introduce Dr. Hildreth. Thank you.
Good morning, Nashville. As you've heard, record numbers of COVID-19 cases are being reported in cities all around the country, including here in Nashville. And in many states, the pandemic curve is heading in entirely the wrong direction. Some of the states that moved forward in reopening their economies are now finding it necessary to shut them down again. Unfortunately, this scenario was both predictable and predicted by public health experts. The COVID-19 virus cannot be wished away, and ignoring it will only make it more difficult to deal with it as we go forward. A few weeks ago, some leaders were already speaking about the second wave being worse or being more manageable than the first. Some even suggested that there wouldn't be a second wave in the fall. Well, technically, maybe they're correct, because if we don't do a better job than we're doing, the first wave will not have ended by the fall. To put the current situation in perspective, let's consider a key parameter that we've talked about before that public health officials use to monitor how well we're doing. That parameter is called the basic reproductive number, or R0. It is a measure of the contagiousness of viruses, and what it measures is, on average, how many people will get the virus from someone who already has it. The basic reproductive number is one of the metrics we're using here in Nashville to monitor how well we're doing, and the goal is to keep that number at 1 or below. And as you've heard, here in Nashville is slightly above 1. And when the number is 1 or below, that means that the virus is disappearing from our population. To demonstrate how important this concept is, I want to tell you a story about a family in Texas. They had a birthday party, and 30 members of the extended family gathered and were in attendance at this birthday party. It's not clear who it was, but one of the family members had COVID-19. Over the next several days, 17 of the family members became ill and tested positive for COVID-19, including children, parents, grandparents, and others. Some of them developed a disease so severe that they had to be treated in ICUs. So in the instance of this family, the basic reproductive number was 17. 17 individuals got the virus from the one person who came there infected. This is not an isolated event, and many such events have been reported around the country, and they're referred to as super spreader events. This story also reminds us of what constitutes an exposure that creates a risk of getting the virus. That is, for 10 or 15 minutes or more, being in the presence of someone who has the virus without wearing a face covering and without maintaining social distancing. In such a scenario, the basic reproductive number can easily exceed 1 and often does so. So imagine what the basic reproductive number would be in a crowded bar, on a crowded beach, in a crowded comedy club, or in any other situation where large groups of people gather without wearing face coverings and without practicing social distancing. And because so many people are not taking the threat of the virus seriously, we're witnessing basic reproductive rates in certain settings that are tremendously higher than 1 all over the country. Here's what you need to know. The substantial number of people infected means that the virus reservoir is much higher than it was before. So if you combine a basic reservoir being much bigger, along with a much higher basic reproductive rate, you have the makings of a truly disastrous situation. And that's one of the reasons why the director of the National Institutes of Allergy and Infectious Disease predicted that we could see 100,000 infections per day if we don't do a better job of mitigating the virus. Also in Texas, in Houston, the Texas Medical Center is one of the largest hospital complexes in the world. They have 20,000 hospital beds among all the hospitals there. They have now reached their ICU capacity, and adult patients are being treated in children's hospitals, to give you a sense of how bad the situation is. And what this means is that the collective events in Texas that are spurring the virus on have created a really untenable situation there. And this just points to why keeping the virus reproductive rate under 1 is so important. Independence Day weekend is upon us now, and it is a time when celebrations can easily drive the virus rates higher. And we don't want to be in a result like we see in Texas and in Houston. So as Dr. Jahanger said, we need to be vigilant and do all those things that we know will limit the virus's spread. So please keep your gatherings to small groups of 25 or fewer. If possible, celebrate outside where the chances of virus transmission are lower. And when you're not eating or drinking, keep your face covering on. And by all means, keep your distance and wash your hands often. We've done reasonably well up to this point in Nashville in keeping the virus in check. But some national tracking algorithms show us that if we don't keep doing what we need to do, we could easily find ourselves in a Houston-like situation, and we certainly don't want it. We don't want that. So let's do our part, especially over the coming weekend, where there be a temptation to go back to old habits, and that's the worst thing we could possibly do. So Nashville, we got this. Please don't be a vector. And with that, I'd like to turn it over to Jeff Roberts, Administrative Elections for Davidson County. Thank you.
Thank you, Doctor. Good morning, Nashville. Have you sent in your absentee ballot request yet? If not, today's a great day to do that. The COVID pandemic has caused each of us to do a little more preparation and planning as we prepare for to go through our daily lives. The same thing applies for voting. We're trying to make that easy for you. You've got 3 options. You can vote with an absentee ballot, you can vote during early voting, or you can vote on Election Day. In Tennessee, to vote absentee by mail, you must send in a request to us. You can get that request at our website, nashville.gov/vote, or give us a call at 615-862-8815. Time is running short, though. The absentee request must be received in our office by July the 30th. But just like we're all experiencing some issues with COVID, the post office is also. They've recommended to us that voters allow at least 7 days for their ballot to return back to us. So that's a pretty short window. Your ballot has to be received in our office on Election Day for it to be counted. So keep all of those dates in mind as you focus on or make your decision as to whether or not you want to choose to vote by an absentee by mail ballot. If you don't want to choose to go in that direction, in-person voting, we will be ready for you. In-person voting will be touchless on the machines, so you don't have to worry about the person who voted in front of you. That process will be touchless. Also, we will be doing social distancing, so keep that in mind. Lines could be a little bit longer, there won't be as many people allowed inside. If you need to give us a call, have questions about voting, please feel free to do that. We want you to be prepared, but please make those decisions now as opposed to waiting until the last minute. The last day to register to vote is July the 7th. To make that happen a little bit easier for you, we're going to be open at our office on Murfreesboro Pike Monday and Tuesday until 7 p.m. So if you're the last minute person, come out and see us Monday and Tuesday, and we will get you registered. Thank you again, Nashville. Turn out to vote.
Thank you, Mr. Roberts. We'll now begin taking media questions, starting with Jeremy Finley at WSMV. Jeremy.
Good morning. Thank you for taking our questions as always. We are hearing repeated cases of people in Metro who have tested positive for COVID-19 and people who have come in contact with them who have not been contacted yet from contact tracers. So my question is if you can give us any idea how many people on average have not been contacted by contact tracers that have tested positive. I also wanted to ask something about what Dr. Hilder said. We are allowing, you said, to keep celebrations to 25 people or less. But then we hear, like you talk cases of what happened in Texas as a family of 30. So I don't know if that sends a confusing message to people of how many people they should celebrate with this 4th of July, if 25 is too high or what you would advise. And finally, I wanted to ask a question on behalf of parents. As children are wanting to gather this time of year, if you are discouraging birthday parties and the such for children, as parents are wondering if that's a bad idea for there to be birthday parties, even if they're outdoors. Thanks.
Thank you for your question, Jeremy. And Dr. Wright will answer your first question.
In regards to contact tracing, the standard that we're seeing right now for our contact tracers, or as we like to call them, disease investigators, they are, once they have the results, they are reaching out and talking to over 90% or approximately 90% of all cases within 2 days of receiving that information. And the only thing that's delaying them a lot of times is a return call back from the individual. And we're then contacting any contacts that we've identified to that case within another day. So I'm not sure. I know that we're doing a very good job once we get the information, and I do know that that there was an issue uploading some of the lab for a short period of time over the weekend. That is a state function that we had a problem with. I know that has been corrected, so I would not think that will continue to be an issue.
Thank you. And Jeremy, regarding your two questions, they kind of, in my opinion, are almost the same about parents and birthday parties as well as groups of 25. The short answer is, ideally, the less people you interact with, the better. And when you interact with them, so if you have a family gathering, just because you know them and just because you love them doesn't mean they don't have the virus. Okay? So don't know hugging and kissing. Stay apart. If you're putting, if you're over 25, so that has happened here in Nashville too. And then that goes to birthday parties, right? So, kids' birthday parties, if you're gonna do it, try to do it in a smaller setting. Kids obviously are less, it's harder to control some of these variables, but try to do it in as small of a group as possible. So that's the answer there. Thank you.
Blake Farmer, WPLN. Blake.
Thank you. This decision to move back to phase two, it feels like the primary issue is the bars. You talked about record clusters around bars. When did you start seeing this, and can you give us, a little more detail on what kinds of clustering you've been seeing and over what time period?
Dr. Jungir?
Yeah, thank you, Blake. So what I will tell you is Saturday afternoon, I got a call from one of our leaders of our epidemiologists, and this is not something that typically happens. That I get a call, they're like, "Hey, we're starting to see something," and very quickly, this was right at the beginning. They recognized that there was some trend out they were starting to see that was not typical. They reached out to me. We reached out to the mayor, and all the teams really started working together all weekend to get into the details here. What we're seeing is there are about at least 10 locations around the city that have had at least a total of 30 people confirmed that have tested positive, and these are Davidson County residents. There's maybe others who are at these locations that live outside of Davidson County that may have been infected, and I think that's what this was atypical, right? So we're also starting to see a decrease in the age of the individuals infected. We're starting to see a difference again in zip codes where people are infected. And so these are the variables that alerted our very astute public health investigators that, hey, something different is happening here. And so I guess that's kind of how we started becoming aware of this and started really quickly addressing this. So thank you.
Kara Hartnett at the Nashville Post.
Hi, thanks. I just wanted to get an update kind of on the evolution of our reopening plan. Will there be any material changes to the way that you comply with benchmarks this time? Last time we moved forward despite rising case counts, do you think that was a mistake? And also, has there been discussions about changing the current benchmarks? With the rising cases, shouldn't we have more cases or shouldn't we have more contact tracers and more testing capabilities? And just to clarify with the bar closures, what does that mean for Lower Broadway? Because we were allowed to have bars open because they had food. What are you going to do about the crowds there?
Thank you, Kara. Dr. Jungir?
Yeah. So, Kara, I pushed back on your premise on. I pushed back on the premise of your question, frankly. When we rolled into phase 2 and phase 3, I think we've always discussed there's multiple metrics we're looking at. And at that point, yes, case counts were going up some, definitely not the percentage were going up now. And we cautiously said, hey, we're moving forward. And we had our contact tracing team to quickly recognize if something was changing. Now, over the past 4 days, we've had 2,100 cases. Well, the metrics quickly show that we're raising much more quickly in our number of cases. And the metrics, if you look on our dashboard that went to red, our transmission rate has been around 1.1. We'll see what happens to that over the next couple of days. But I would say the metrics that we looked at it's what directed our decisions to move forward and move back. But again, not one metric, and we've never said it's just one metric. Now, if one metric is way out of like it is with these nearly 2,100 cases, well, I think we have to be sensitive to that. Regarding what it means to bars at 50% capacity and so forth, I'd refer you back to the previous orders of 1 and 2 about what, it's a question of revenue versus food, and there's a nuance there. But we're going back to the same definitions that we used from the very beginning of this. So thank you.
Harriet Wallace at Fox 17, you're on the air.
Good morning. I've got a few questions for Mayor Cooper. First question, a lot of parents want to know, what will this mean now with regards to schools reopening as we see us reverting back to phase 2? Also, what do you perceive to be the financial impact as we are closing down a number of venues? And then lastly, for Mayor Cooper, there were a number of downtown bars who were criticizing you for closing them. Now that we've seen these cluster outbreaks, your response to that criticism in light of that? And then for Dr. Jahangir, where are we on overflow hospital as we're seeing the hospital capacity being challenged some? Is the Music City Center still being considered? And do you all believe that we moved to phase 3 too fast? Thank you.
Thank you, Harriet. Mayor Cooper.
Thank you, Harriet. There's a committee meeting this afternoon. It'll be a public meeting of the school reopening committee. Again, all the schools in Nashville are participating through that community, public, charter, diocesan, and independent schools are part of that. They'll have to address what this is going to mean. It is a great concern to everybody. Digital learning, how we execute it. We always knew that we were going to need that element, and we have to be prepared for a good digital learning environment for all of our school children. But it's going to be hard to do. And again, that committee this afternoon will have more details. As to financial impact, well, it's going to be worse if we don't get ahead of the spread of the disease. Whatever financial impact this has, it's going to be worse unless we get ahead of it. So we just have to go ahead and get it. And then your criticism of us for opening, I mean, let's just go back to first principles. You don't have a right to spread the disease if our contact tracing feels that you are advertently or inadvertently in the process of doing that. We have to be on that and curb that practice. Contact tracing has been valuable as we learn doing this together. And, there was an earlier question about our metrics and our dashboard. I feel that our dashboard and our metrics worked. That's why we're here today. It shows red. We are responding to that. I don't think the metrics are wrong. I think we have to just keep looking at the dials on our dashboard all the time to measure how we're doing. And again, this is the first kind of red reading that we've had on the dashboard since we began this some months ago, and we have responded. It is, sad that it's at the 4th of July and we have to go back to some degree, but it is worse if we don't get on it. And that's what we're committed to doing.
Regarding hospital capacity, Harriet, I would say that our hospital capacity right now still, thank God, is good. We have, as I mentioned, 148 individuals in hospitals in Davidson County. There are about 2,000 beds in Davidson County, around 3,300 beds in regionally. Regionally, we have over 20% bed capacity, both in ICUs and regular beds. And I will say those numbers that I give you are prior to any individual hospital's capacity surge. So each hospital has built-in capacity surge in addition to that. Besides that, there is about 70 beds available at Nashville General that's ready to go moment the state pulls the trigger to immediately respond to COVID. And the state also has another backup plan in addition to that, which has not been built out, but they're ready. In fact, the mayor and I met with Commissioner Piercy and Deputy Commissioner McDonald yesterday to discuss this exact issue, because I think hospital capacity is something that we should watch carefully. Thank goodness right now that is not an issue. But I want to highlight part of it's not an issue is I don't know if I want to use a word fortunate, but our high infections are in people who are under age 40 or healthy. If those individuals under 40 are not careful and they get their grandparents sick and their grandparents all get sick and need hospitals, we could be out of luck. So this is why personal responsibility is critical. So thank you. And Dr. Hilders would like to add to that. Thank you.
I feel compelled to remind all of us that none of this is being done to be punitive. These things are being done to save lives. And some of what we're seeing can be traced all the way back to Memorial Day. As a matter of fact, a person infected on Memorial Day could have accounted for about 500 infections by this time. So this is not meant to inconvenience you, it's not meant to be punitive to businesses, it's meant to save lives. That's what this is really about. And it all comes down to personal responsibility. If each one of us does what we need to do, we can keep moving forward. What's happening is a failure of responsibility, so that we have 600 cases in a single day, and clearly we can't go on like that. But the personal responsibility, each one of us doing what we need to do, is so important. And as you've heard me say so many times, wearing one of these, if we would all do it, we can get to a new normal sooner. Thank you.
Just a small correction, the school's meeting today is not a publicly noticed meeting. Next is Carice Jackman at WSMV.
Yes, good morning, everyone. My question is for Mayor John Cooper. Have you spoken with leaders in neighboring counties about precautions that they're taking as well? Because we all know people frequently travel from Davidson to Williamson, Davidson to Rutherford, Wilson County. And then my second question is, considering the changes and modifications going back to phase 2, will you guys consider strengthening the mask mandate at this time? Thank you so much.
Thank you. Mayor Cooper.
Thank you. I have begun talking to neighboring leaders and to the state also about potentially treating the Nashville region together on a more consistent protocol, particularly on the density of gatherings and on masks. I think this is something that I hope the state looks at, and I think other counties are too. We will be sending out, we send out and communicate particularly what we're doing in terms of Davidson County in terms of masks to keep people up to date. And again, I was pleased that last night Knoxville adopted a mask order, their public health board. And so I think individual communities are coming to the same conclusion that we are, that you have to use all of your tools to deal with this difficult disease. And then I'm sorry, your second question was on how we're going to change our mask ordinance. No, I mean, I think it's well written. We needed compliance, enforcement. We've all understand it's going to be tricky in some cases. You know, we're not equipped to monitor 700,000 people's uses of masks. This is why we need the media and each other to communicate how important that is. There was a time in the coronavirus where I don't think people felt that masks were as important a tool as we do today. And but I think the whole country is coming to understand that it is an important tool. It's not a perfect tool, but it is one of the tools that you have, and that we should use it, and everything that we can do to slow the spread. So I'm asking, again, the media and everybody listening, I think Governor Lee does this routinely in his press conferences, to encourage people. Again, we've learned over time, smoking and seat belts, there are a lot of things that you can do individually that's going to save your lives and your loved ones' lives, and so do it. The role of the state at every single moment to make you do it is not going to get the kind of compliance that we need to have, which you're going to have when you voluntarily comply, and that you understand it is in your interest. However, it is hot weather and it's a pain, and I know all of us would wish that we didn't have to do it, but we do and we should, and it's protecting your loved ones too. Thank you.
I would also like to reiterate what Mayor Cooper has just said, that the mask order is very strong, and that we are going to educate the community and guide the community toward compliance, and we need all of your help. I have seen compliance increase in certain parts of the community and not so much in others. But at this time, it is a very strong order. Please read it, and please help us comply with it. And then if we need to strengthen it, we will down the road.
Ian Jung at the Tennessean.
Good morning. Mayor Cooper, you mentioned there's going to be a committee meeting, but I was hoping you could share some information about what this means for schools. I mean, as of now, with the number of cases we have, is it feasible to say that in-person classes will start up in a month from now? Is there consideration to push back the first day of school to after Labor Day? And then for Dr. Jahangir, you mentioned that you were alerted, on Saturday about a trend about bars. Can you share any information about the timeline of when these dirty new infections were discovered and kind of the decision to wait till Friday for this revert in the plan? And just kind of about, I think it was previously asked, but, Lower Broadway serves food. So in general, with this weekend especially, what is enforcement looking like in that area? And lastly, with our hospital capacity, we serve as sort of a regional medical center for a lot of our surrounding counties. What does the capacity look like, to serve people outside our county and maybe numbers rising in other areas? Thank you.
Thank you. Mayor Cooper.
Thank you, Johan. I'll go first on the schools committee. The schools are publishing and have published their own plan. They worked through this with public health very carefully. It is a very detailed plan. All the schools that have been participants in this committee. Now, there's not a direct mask order that is applying to schools. Why? Because the schools have their own plan. The schools are going to be implementing their own health plan, which will include, I'm sure, a use of PPE with specifics as they manage what they have to do in that space. So that's why the mask order does not apply to MMPS or to schools. Also, many of our schools are religious. And of course, in America, that creates kind of a separate lane of its own. But everybody is working together and working together with public health to work on the problem. We're also moving today sharply to create an environment where maybe in a period of time we are back to where we were and that we are maybe ahead of where we thought we would be. That's why we need everybody to help us. If we want to get schools back, wear your mask. Stay in gatherings of below 25. Don't add additional risks to the community. I hope this gets everybody's attention because having schools reopen is of such a community value that all of us need to be helpful in that work. That's part of the reasons why we're making this announcement right now. You've got more than a month before they open. We don't know what the health picture will be in a month. It can be better, could be worse, but we want it to be better, and it's going to be better with your help. So, but again, that's why the mask order does not specifically address the schools, because it's of such importance in the management of those facilities in a healthy way. It has to be more detailed and administered by the school administrators. Now, the people under 12 are exempted from this also, and part of this. You've got a communication part of it. You've got a compliance, something that adults are finding difficult to do. We are going to have children also do somewhat, but again, it's going to be a whole list of responses. And again, I think Dr. Jahangir was going to answer your second question, Johan.
Thank you. So regarding the restaurant bar thing, if 50% of your revenue comes from food, and it has just historically, then you're a restaurant and you can stay operating. If it's less than that, as in the previous phases, then you're a bar and you're not operating. So that's your question on hospital capacity. Again, as I mentioned, 148 individuals are currently hospitalized in Davidson County residents, because you are right that Davidson County is a place where a lot of people from all over our regional areas come for care. Our hospital capacity for the region is over 20%. We've just as early as yesterday had conversations with Commissioner Piercy and Deputy Commissioner McDonald about the triggers for the alternative care side. Every week, you should know, for the past 6 to many weeks, all the hospital CEOs and I speak with Deputy Commissioner McDonald around this issue. So this is not an issue that surprises us. We're comfortable where our hospital capacity is now. Make no mistake about that. And then your other question around the timeline, very quickly somebody recognized something, they raised their hand. we started investigating it, and I think we responded in a very quick manner that will probably end up saving lives. So thank you.
Our final question today is from Chris Davis at News Channel 5. Chris.
Dr. Jahangir, some people will say Metro Public Health just issued the mask mandate, and you all haven't given enough time to see if that is effective enough. What would be your response to that? And then, Mayor Cooper, given the decision to cancel the 4th of July fireworks because of crowd sizes downtown, will you, Mayor, personally reach out to the organizers of this weekend's scheduled social justice protest to ask them to reschedule because of those crowd concerns?
Thank you, Chris. Dr. Jahangir.
Yeah, Chris, thank you for that question about why not let the mask mandate see if it has an effect. The reason is this is really important. Like, I'm a trauma surgeon by my day job, right? And if somebody's bleeding out, I'm not going to wait to see if maybe the bleeding would stop because I gave them some medicine. I'm going to do something in addition to that to prevent what is a really severe number of cases in a short amount of time to deal with it. Now, I hope by now the mask mandate, which I think is critical, I mean, that's why I call the Friday afternoon meeting as my capacity as chair of the Board of Health, as well as now what is a big step to decrease crowds, that we can quickly solve this bleeding, as if you want to use that analogy still, and we can quickly solve this problem of increasing cases. And I hope very quickly we can start seeing a stabilization in our numbers and a downward trend. And then we could look about what should happen again. But I think I think you should see by the speed and by the level of what we're doing that everyone is taking this very seriously, and the people of Nashville need to take this spike in numbers very seriously. Thank you.
Thank you, Chris, for that question. I think of the two things you're talking about, the fireworks and then a conceivable public gathering or demonstration. Metro is in a position with the fireworks of actually paying money to create what could be a public health risk. Okay, well, that's an easy decision to say, or easier decision, it's sad, but you don't want to do that. So are we going to pay money to create a public health risk? The demonstration, you got First Amendment rights. And yes, everywhere that I am in touch with these demonstrations, I want us and everybody else, we may not be able to prohibit them, but we certainly want them to wear masks. We certainly want them to walk with their arms outstretched so that they're more than 6 feet apart. The ability to social distance and wear a mask, historically, demonstrations in terms of contact tracing have not led to an outbreak. What leads to an outbreak if you're indoors, close to each other, breathing on each other without a mask, you're going to spread the disease. And so we're trying to get to deconcentrating those at-risk situations and encourage the public to help us to do that. But as to the fireworks, as sad a decision as it is, that ultimately is, are we going to spend money to create a public health hazard inadvertently or with the best possible intention? And of course, we embrace our tradition of fireworks, but that's a very different decision. And of course, you're not going to do that. And it's not a decision about people's individuals' rights. It's about, are we spending Metro money to create an inadvertent public health risk?
Those are all the questions we have this morning. I'd like to thank Dr. James Hildreth and Mr. Roberts for joining us. One quick correction to the press update that was sent out this morning. The next Metro COVID-19 press briefing will take place on Tuesday morning, July 7th, followed by another briefing on Thursday, July 9th, both at 9:30 a.m. Thank you for joining us. This concludes today's event.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.